My name is Lauren Caldas, and I'm from Mechanicsville, Virginia.
Macosin, Virginia.
Ruckersville, Virginia.
Virginia Beach, Virginia.
Richmond, Virginia.
I chose to become a pharmacist years ago because I was really focused on helping patients and really wanted to be accessible to the community to make a difference in people's lives.
I was interested in how medications work and how they affect the body and what exactly goes into that process to make somebody feel better.
When I grew up in a very small town called Blackstone, Virginia, there was a lady pharmacist, which at the time was pretty much a novelty. And my mom had a little beauty shop, and across the street was a drugstore, and she said, "Ms. Marshall, you ought to be a pharmacist. You get to wear a white jacket and drink all the Coca-Cola you want and take care of all these people that need all these pills."
I like the part of being a pharmacist with a medicine to save people their lives and also their health so that they can live happier and longer lives by managing their chronic diseases, blood pressure, cholesterol, and diabetes specifically. If I can keep them healthy and living their lives in the community and out of the hospital, that'll make them happier and it'll serve our community in a better way.
We had a customer of ours who was transitioning out of the hospital, and they were confused. They had many pages of discontinued medication lists and the list of medications that they were supposed to be on. So we were able to sort through that and figure out what their current therapy was, how they were supposed to implement that current therapy, and then send them on their way to the home where they were going to be followed up with nurses and proper care.
I do things where we catch interactions that literally would put people back in the hospital. They get discharged on a medicine. It was a change from what they were on, and lo and behold, they call in the old medicine. If they take the two, it literally would put them back in the hospital. And we know that that's not paid for anymore. It's not going to be paid. And yet, I do it to take care of my patients.
We had a patient come in who I was doing a Medicare annual wellness visit on under the supervision of the physician through the collaborative practice language that Virginia allows for the scope of practice. And I had a patient where I was also doing a comprehensive medication review on that patient, and I was looking at lab work associated with different medications, and I noticed one of the lab work was off. So I approached the physician before I even saw the patient because the TSH and me ordering that was not on the collaborative practice, so I wanted his input prior to the appointment. From there, the physician took the ball, took care of the issue, started the levothyroxine, which to treat the patient, and now the patient is doing much better. So my physician who I was working with looked at me and he said, "That is a great catch." He said, "I don't know how we missed it." He said, "And it's your eyes that found it." And he said, "And I will make sure that our physicians know that." So he's been very good and a very good advocate for working with me because he and I have had that working relationship for a while now. And so he's come to respect the opinion and the other advice that he can get from a pharmacist. Currently, we're not recognized as healthcare providers under CMS. And so when it comes time for us to see those patients, there's a little bit of boundaries and barriers that we have in place to try to overcome.
Not only is it billing though, it's just recognition on what we do in the community service we perform.
We see a patient 6 times more frequently than any other healthcare provider. And notice what I just said, 6 times more than any other healthcare provider. I'm seeing the patient and interacting with them. And you're telling me I'm not a healthcare provider? No, we are. It's time to change the law.